tough problem. I think, first of all, I think if you were here yesterday, I mentioned doing a search on lipedema, and the librarian, who you would think would understand that terminology, came up with lymphedema and then lipids, cholesterol, and I got thousands of articles on cholesterol. So a lot of, I think, medical personnel don't know what lipedema is. So I think that's the first issue. It's a little bit of a problem. So let's see. I have no disclosures. Okay. So maybe the first thing you might want to do is talk to your doctor. First of all, just here's a simple statement. Doctor, I think I may have lipedema, a painful fat disorder. Are you familiar with that condition? And, oh yeah, sure, I know what lymphedema is. No, lipedema. You kind of have to spell it out, L-I-P-E, not L-Y-M-P-H. So that may be the first step, to ask that physician. And if they're honest, they may, and they probably won't be always, I mean, we're not always honest, I guess, but they may not know what it is. And what I do when I don't know what a condition is, I pretend I got a page, and I walk out of the room, and I go to Google or Ovid. We use Ovid. I don't know what you use, Steve, Ovid. But, and I look up the disorder if it's something that I'm really not that familiar with. So a good physician may do that, or he may not do it, or he or she won't know what it is. So I think that is a problem. First of all, you want to make sure they know what it is. And if they don't, you can educate them. And I think the next slide says, make an appointment with your doctor. Let them know in advance, the front desk. Hopefully they will communicate to the doctor that I'm coming in to see the doctor about lipedema. And in this situation, I think that I said include pictures and or articles. Now, some physicians will be offended by that. That's okay. It's not about them. It's about you. So give them information. Take a picture. Not necessarily yourself. You don't have to do that. But you can certainly go on and online and find lots of pictures that, and articles, something that's easy. The Society of Vascular Medicine, we have a journal, Vascular Medicine. I think I have a 2-page article on there that you could copy and give to the patient. But I'm sure Steve Dean has written many, many articles on that, and many others, obviously Karen and others that are attending here. So get an article, nothing really lengthy, but something that you can take with you.
I think that is excellent advice. Now, when I come in and I go into a doctor and I say, I think I may have lipedema, and they go, oh, that internet disease. How do I respond?
Well, again, I think that that physician, he or she, doesn't take the disorder seriously. And again, I think it's all about education. So you have to, you know, if they roll their eyes, then maybe you should just stand up and walk out. And, but on the other hand, you probably, again, should try to educate him or her the best way you can by saying, yes, it is on the internet, but so are many other disorders. And maybe that's how we learn. And so I wouldn't take it as a negative approach.
One of the things I've done in, you know, I don't tell, I think we all have our own journey. I think we all have our own style. One of the things that I do is I focus on what my problem is today, and is lipedema a contributing factor. And so sometimes I then will slide it into the conversation. I've actually I had to go see a specialist for something that I thought that this person would take an interest in. So after we talked about what my specific issue was, I said, oh, by the way, I have a condition called lipedema, and here's some information on it. I thought you might appreciate it. And it was very well received. So how we approach our physicians, and not always thinking, you know, I think part of it is our delivery. Part of our delivery is going to be very helpful for, you know, for them to say, oh, what, you know, that person's reasonable, and they're not coming in here, what do you mean you don't know it? Are you dumb? You know, that's not, you know, I always say, you know, a little honey, you know, I'm from the South, a little honey will catch a lot more than the vinegar does. So how you approach, I think, is very important in using some of these tips that Dr. Bartholomew has given us too.
Yeah, I was looking for a couple things that I might have put in here about writing down what your concerns are. I think that's a great idea that you go in. You don't want to overwhelm the physician with way too many complaints or issues. We don't have time, unfortunately. Many of us only have 15 minutes or 20 minutes for a visit. And if you think you need more time, you should schedule more in advance with the office help. Just say, look, I have a lot of issues. I think I need more than 15 or 20 minutes of Dr. Bartholomew's time. And the other key is try to get an appointment first thing in the morning, because if you come and see me, you're going to be very late at the end of the day. Right, Ann? I mean, I'm always late for when she comes in. Miss Norris back there, you want to wave your hand? Yes, yes. She comes an hour early. I just want to make that noted, that you are always there an hour early, and I'm usually an hour late. But getting an early morning appointment is a good idea, or perhaps the very last one of the day. But so.
Or the first one after lunch.
Ah, okay.
So the after each session.
Sure, yeah, that's a good thought too.
Oh, absolutely. What are some other tips you have for us, Dr. Bartholomew?
Let's see. Why your doctor might not listen to you. Many physicians do procedures, and the ones that are here are great. We know that. But doctors, as I already pointed out, we often have 15 to 20 minutes is all for an established visit. I get 45 minutes for a new consult at one of the regional hospitals I go to. I get 60 minutes for a new patient. But oftentimes that's not enough as well. And your doctor might have a different agenda. I guess your doctor really wants to zero in, as you pointed out. You went in that one time, you told the doctor what your current complaints, and then you mentioned lipedema. And we're all using the electronic medical record. I don't know if all physicians are using that, but that takes up an awful lot of time. We're always trying to look at, I can type and look, but many physicians have their head right into that electronic medical record. And we have to complete all these records. These are health care requirements. They take time. If you're not a good typist, that makes it more difficult. So, you know, I'm looking at it from the physician's point of view. And here we go. So the doctor will see you now. I can't promise he'll talk to you, but he will see you. Is, whoops, a good thing. So be organized, keep good records, set the tone, be assertive. If you have a problem, make sure the physician knows what it is, and be understanding and know how to keep in touch. Again, book the first appointment of the day. Don't go in with a list here. I want to know, here's this person saying, I thought it might help if I listed my symptoms, just a few too many. If you have 20 to 30, you're not going to get through to see that physician or get all of them answered, obviously. So limit it to one or two of your major concerns, and from there, okay?
So if, other than getting a diagnosis, if I don't feel like my primary care can help me, they're not willing to diagnose me, what are the things, as a very specifically a lipedema patient, should I be asking them to help me with? So we get over the hump of, okay, I'm not going to get a diagnosis, but I do need some help. What are the top two, three things I should be asking my primary care to help me with in my journey?
Well, I guess first thing, if he or she doesn't know what lipedema is, then you may ask for a referral to a physician who does know, if he or she knows, if they know who in the area is an expert on lipedema. I guess then, I'm not sure I have a second or third thing. If the physician has no idea what it is, then how will he or she be able to help you? But unless you just concentrate on your current concerns, whether it might be pain, how can he or she help you? If it's diet, sometimes they can help you with diet, but a lot of physicians are not very good with diet, and I'm sure we all know that. I'm not very good with diet, prescribing diet, but I know how to order a dietitian consult. So you might ask the physician, look, I'm worried about, if it is a weight issue, I'm worried about my weight, can you refer me to a dietitian? Because of my pain or swelling in my legs, can you refer me to a physical therapist that knows about lipedema, and make sure it's lipedema, not lymphedema.
And if I need some help with, maybe I realize, I've got some swelling, I probably should be in some compression, what would be some things I could say to my physician to say, instead of me just coming in and saying, yes, I need you to order me physical therapy, I need you to order me MLD. Do you think that's a good, first of all, is that a good approach when approaching a physician who may not otherwise be open to
most of the time I don't think we like to be told what to do. Maybe you've noticed that before. You know. What's that, Dr. Dean? Yeah, no. Yeah. No, I try to listen, but sometimes we get a hair up our rear end, and if you know what I mean by that, and we can sort of, that can sort of change the whole conversation. We become defensive, so we're human beings too, most of the time. I guess if you had a specific condition, swelling in your legs, you might ask the physician if he doesn't, he or she, I keep saying he or she, want to be no sex bias here. But look, I have swelling in my legs, and if they don't know what lipedema is, then how can we address my leg swelling? And typically a physician might look at your thyroid or your kidney function or liver function or your heart. Specifically, they should look at your medications. Are you on a calcium channel blocker? Are you on Neurontin, for example, which we know can cause swelling, or ibuprofen, which can cause swelling? So they may want to go down a set approach, an algorithm of how they would approach leg swelling. And then you might ask them about compression garments or something to that effect.
How would I, especially in today's age of with the opioid crisis and I've got some pain, how do I approach a pain conversation with my physician without looking like a drug seeker?
Yeah, no,
is that a question you guys all have?
That's a really a big problem. In Ohio, you know, as in any other state, we have certain regulations. At the clinic, if I order someone a pain medication, let's say it's oxycodone or something like that, and in my field, and Dr. Dean's as well, we deal with patients other than, of course, lipedema. We deal with patients who have severe peripheral arterial disease with gangrene, and you know they're having pain, but we still have to be careful with writing prescriptions. So if I write a prescription for a oxycodone or equivalent, I have to put a starting time and an end time. And I think I can only write it for 1 week at a time now, and in the clinic pharmacy. I have to be very specific about that. So at least for that particular situation. Other things you can write for up to 3 months, but so I think that's one issue. And then we can talk about other methods for pain control. We can talk about topical agents, for example, and some herbal medications, something of that nature.
Okay. What are some of the other, you mentioned asking them for a specialist, and I think I'm just kind of wanting to bring this back around is we've asked them for a specialist, they go, I don't know of anyone. There's nobody in my region. What are some of the things I can do as a patient for some self-care? What are the things I definitely need a doctor to help me with versus what are the things I can do on my own?
Well, to find a physician, you can go on our website, right? Your website, FDRS. I actually Googled, I'm looking for a doctor who knows lipedema. I didn't get anything when I Googled that, so that may not be well, I did get some surgical options for liposuction, but nothing about general medical care. So I don't know. And looking at your website, do you have some examples?
I do. Let's take a look at let's look at our website.
Want to get up? Do I have
It'll
to get
take
up?
just a moment.
Okay.
So if you go to fatdisorders.org, I hope everybody's had an opportunity to visit the website at least a couple times. They're pulling it up in the back. All right. So one of the things, if you let's go ahead and scroll all the way up to the top of the website there. So when you go to our website, you will see that there's it says home, it says lipedema, Derkums, and it says treatments. And these treatments are intended for both lipedema and Derkums patients in general. And of course, there's, everybody's individual results will vary and what's going to work for you. And I think we've heard a lot of folks talk about, and I think we hear about in the groups as well, is that we have to figure out what works for us. What works really well for me may not work as well for Tammy, but what works for Yvonne may not work for me. So we have to really look and figure out what are the things that are going to work for us. But if you go to the treatments, and then go ahead and scroll back, and then go ahead and scroll down to, we have what we call the treatment butterfly. And it really puts together what are the different treatments that are currently available for us, for those of us who do suffer from a fat disorder. And so we broke it down between the how do we reduce inflammation. One of the things that a common trait that we all have is that we have high inflammation. What are the things that we can do to reduce that inflammation? A lot of that has to do with the foods that we eat. We all try to avoid the D word. Because the D word is a word that we don't like to use, but it talks about what kinds of foods that we eat and nourish our bodies with can help us with reducing that inflammation. We also then talk about how do we manage pain. Pain management is not only medications and supplements. Part of managing pain can come through, and that's why we have with the diagram there that we have some things in the middle. There's different things that we can do. We want to improve our lymphatic flow. What are some of the things that we can do there? Compression, MLD, dry brushing, vibration, and utilizing a pump. How do we help our body deal with lipedema? We have a number of things that we can do there. And then I think most importantly for all of us is that emotional support. Do you have a good support system at home? Do you need to join a group? I think many of us get a lot of emotional support from our Facebook groups. But some of us need to go ahead and take the further step and maybe even explore going to counseling. So as we scroll down the website, each of the different options that are available to us are on the FDRS website. So let's start with, let's say, nutrition. So you just click on the picture, or you can click on Learn More, and here's some of the information that FDRS has on nutrition. As you scroll down through that page, at the bottom of the page, and this is going to be the same for any page on our website, is that we're going to link you back to some of the videos that exist on our YouTube channel. Which, oh, by the way, we met the 2,000 mark for the subscribers. Yeah. One of the big missions of FDRS is being able to provide education, and a lot of that education that we have seen has been through the YouTube. Dr. Bartholomew, how many times do you hear a patient come in and say, I watched a YouTube video?
For me? About me, you mean, or what?
Just yeah. That they saw you on the YouTube.
I'm kidding. Yeah. I don't know. I don't ask that.
Okay.
I should. I guess I should. But I actually tell everyone about the website, and I have a little pamphlet now that we put together with a nice, pretty folder, and give our patients. And I remind them to go to the website for more information. Yeah. So I think everyone I see, new patient
Fantastic.
anyways. Yeah.
Yeah. So we are FDRS is in the process of updating the website. So stay tuned for that. But it's still currently each of the different treatment options, all the things that have been taught. Most everything has been talked about over the course of this weekend. You're going to find some additional information on the website. It's also where all the videos are. So the videos will be available in the not too distant future from this conference, so you can go back and replay them. We also have broken down by topic. So, if you're thinking, I need to, I heard that compression talk, that was really good, but I'm still a little confused, you can go back and you can view that. When it comes to MLD, we do have I hear a lot of people saying, MLD, I can't get to a therapist, or my insurance only covers X number of visits per year. One of the videos that we do have is how to perform self-MLD, so looking at all the different self-care options that are available to us.
Yeah, no, but does it say there how to find a doctor? Is that on the list or not?
That's coming soon. We'll have a link to, we will have a link for which doctors that we have found that are lipedema friendly.
Yeah. So what about support groups and thoughts on that?
Oh, absolutely. I think the support groups are fantastic. I think some of us do well in a Facebook community. Some of us really need that face-to-face interaction. I am going to guess that many of you came to this conference this weekend looking for some folks that maybe live around you. I know many of the states have meetups. I know I live in Chicago. We have a Chicago area meetup about once a year-ish. We always say we're going to do it more often, but we don't. We intend well. I know that the Maryland folks they meet up. I know I've seen some I think the Texas folks meet up. And so joining some groups and having some of that time to get together and really support one another is very valuable for everybody.
Yeah, so we started one, Ms. Norris, and stand up again.
Oh,
do you mind?
yay.
I know you don't want to, but yeah. So we started one, was it February or January? Yeah, so we have one a month. We've had physical therapists come in and really give some good ideas to all the participants. And I missed the last one. What was that one about? Okay.
Oh.
And so then the next one, we're going to have a dietitian come, I believe, to talk. It's on a Friday night. We have beer and wine, and no, we don't. We have,
I was like, where's my invitation?
we do have coffee, though, I guess, and occasionally healthy food. Now, I actually have found it very enjoyable from a physician point of view, because I've learned, too, there are a lot, you just can't go out and send someone out and get a pair of pantyhose. It's just not one size fits all. And there are some quirks to those types of devices, and so I think the support groups are great. Yeah.
Absolutely. And if I know some people don't live in an area or are unable to travel to go to a support group. So then I would highly recommend that you seek out some counseling as well. I understand talk therapy is very helpful for many of us in overcoming the emotions, and I think that's a huge part of living with a fat disorder is the emotions that are attached to it.
So we have something called a pulmonary embolism response team. It's totally different than this, but we can go online for a urgent consult. So my thought would something with FDRS, would you like to have like a monthly online chat where physicians get on with you and patients are able to join? I don't know how we do it. I can't remember the technology because I can barely turn on my phone sometimes. But but that might be an idea that you could come up with.
Absolutely. Let's chat afterwards. I'm very interested in that.
Okay. Other things? Do you have some more?
No,
did you want to go through that? Let me see. What else did I have? Just things to do. Well,
we can go back to the PowerPoint, please.
Well, what other questions do you have for me?
Oh, brother, what else would we?
Do we have much time left?
We have just a moment, so.
There's a question in the audience. Can we take questions?
Yeah, if you will.
Can you stand and state your name and where you're from?
I'm Margaret Bryant. I'm from Beaumont, Texas.
Okay.
Kind of like Houston. I want to know what a patient should say when their doctor says, I don't know what that is and I don't care.
Yeah, well then, first of all, I would walk out immediately and find another doctor. I mean, that would be a horrible approach if they're not interested. Then I would find another doctor, I guess. But you can, as I mentioned earlier, you could bring in pictures and some articles on what this is, give them information on the website. If they're a good physician, they'll look it up. If they're not, again, many physicians are so overwhelmed, they just might feel frustrated, and we're often embarrassed if we don't know the topic at hand. So, but again, I would find someone, either give that individual a second chance or find somebody else to see you.
I think we have time for one more question.
Where exactly on the website is the resource for finding physicians or therapists?
It's not on the website yet.
Oh, okay.
Yeah, coming soon.
Coming soon to a website here.
Okay.
Yes, coming soon.
Let me see, what else do I have here? Yeah, your doctor might only have 15 minutes. That's a tough one. Oh, if your doctor isn't listening, if you are getting cut off, if you can't finish a sentence, if you're repeating yourself because they're not listening, those are all some keys. And if your doctor wraps up before you can ask questions. So those are some keys to know if he or she is listening to you. I don't know if I have anything other keys here. Okay. All right.
All right. Well, thank everybody. Thank you, Dr. Bartholomew.
Sure. Good.
You'll give your.
What's my advice for the doctor? Yeah, I actually had some slides on that, but I deleted those for some reason of time. I think the doctor should listen to his patients, and if he or she doesn't know what it is, then he or she should research it himself and have that patient come back again. Be open to what they tell you. Many of the patients are, obviously this group is very well informed and know more than most of their primary care physicians. But we should be, as clinicians, we should be open-minded, able to listen, and approach it in an appropriate manner. So I think it all depends on the physician. Okay. Yeah. Oh, can I show one last slide on that talk, or is it too hard to do? I just wanted to see if I could bring that one up. That last talk. I am trying to make things difficult for you. I always, Dr. Dean and I talk a lot, and so one of the questions I ask is, who's taller, if you can tell? And Dr. Dean always ends his talk or starts his talk with some